When you hear the phrase high blood sugar, what comes to mind? For most people, the first word is diabetes. And yes, diabetes is a serious, life-changing condition. But here's something many people don't realize. Your body starts warning you long before diabetes officially develops. It whispers through subtle changes: your thirst, your energy levels, your skin, even how quickly a small cut heals. The problem is, most of us brush off these signals. We think, I'm just tired, or maybe I'm just aging. But often, those small changes are actually red flags from your body, telling you that your blood sugar is running too high. And here's the truth. With today's diets full of processed foods, sugar-loaded drinks, refined carbs, and the stress of modern life, more people than ever are at risk. So in this talk, I'm going to share with you 16 warning signs of high blood sugar, things you may already be experiencing but didn't connect to glucose. And then, I'll also explain the 8 classic symptoms of diabetes that you should never ignore. Paying attention to these signals could save your health. In some cases, it could even save your life. Let's dive in. Sign 16. Excessive urination, especially at night. Sure, if you drink 3 glasses of water before bed, of course, you'll need to get up. But here's the difference. With high blood sugar, you're urinating more often even when you haven't had extra fluids. Why does this happen? Because your kidneys are working overtime. They're trying to flush the excess glucose out of your blood. Think of it like a filter that's overwhelmed. It has no choice but to push sugar out through urine. And here's the concerning part. Over time, this constant flushing can lead to dehydration and even urinary tract infections. If you find yourself waking up multiple times at night to use the bathroom, don't just assume it's aging. Consider your blood sugar. Sign 15. Blurred vision. Have you ever had days when your vision suddenly becomes blurry, but then a day later it seems fine? Many people rush to the optician, but often the problem isn't your eyes, it's your blood sugar. High glucose pulls fluid into the lens of the eye, making it swell. That swelling temporarily changes its shape, and your vision becomes less sharp. So if your eyesight seems to come and go, don't ignore it. Glasses won't fix the problem, but stabilizing your blood sugar might. Sign 14. Difficulty concentrating. We've all had those days where focusing feels impossible. But here's the science. Your brain runs almost entirely on glucose. If glucose can't move into your cells properly due to insulin resistance, your brain is basically running on empty. That leaves you tired, distracted, and forgetful. On top of that, high blood sugar dehydrates you, which also reduces brain performance. So if you constantly feel mentally foggy, it may not just be stress. It may be blood sugar. Sign 13. Dry mouth. Waking up with a dry mouth now and then is normal. But if you notice your mouth always feels sticky or parched, it could be a sugar issue. High glucose changes the balance of your saliva, drying out your mouth. And here's the kicker. A dry mouth increases your risk of cavities, gum disease, and oral infections. So if you're sipping water all day but still can't shake the dryness, it's worth looking deeper. Sign 12. Impotence in men. This is a tough one to talk about, but it's important. High blood sugar damages blood vessels and nerves. For men, this can affect circulation to very sensitive areas, leading to impotence. It's not just about age or stress, it's often a circulation problem caused by glucose. Recognizing this early can motivate men to take control of their health before more damage occurs. Sign 11. Recurrent infections. Have you noticed you're getting infections more often, whether it's skin infections, urinary tract infections, or yeast infections? High blood sugar creates the perfect breeding ground for bacteria and fungi. Sugar is their food, and when your blood and tissues are sugar-rich, infections thrive. So if infections keep coming back, don't just treat the infection. Ask why it's happening so often. Sign 10. Slow healing wounds. Think of a small cut on your hand. Normally, it heals in a few days. But if you notice wounds taking weeks or even months to heal, it's a red flag. High blood sugar damages circulation, reducing blood flow to the wound. It also damages nerves, making it harder for your body to even notice the injury. This is why untreated diabetes can lead to serious problems like ulcers and amputations. A slow healing wound should never be ignored. Sign 9. Stomach problems. If you often feel bloated, nauseous, or notice your stomach empties very slowly, you may have a condition called gastroparesis. This happens when high blood sugar damages the nerves controlling digestion. Food sits in your stomach for too long, making you uncomfortable and disrupting nutrient absorption. It's a subtle but very real effect of poor glucose control. Sign 8. Constant fatigue or tiredness. Everyone feels tired sometimes, but there's a difference between normal tiredness and constant fatigue. When blood sugar is high, your body is like a car engine flooded with fuel. It can't use the energy properly. Instead of fueling your cells, sugar stays in the blood, leaving you drained no matter how much you rest. If you wake up tired, go through the day tired and go to bed tired. Don't just push through. Check your glucose. Sign 7. Excessive thirst. We've all been thirsty after exercise or on a hot day. But if you're thirsty all the time, no matter how much you drink, something else is going on. High blood sugar forces your kidneys to pull water from your tissues to flush out sugar. That's why thirst and urination always go together. If you notice this constant cycle, it's a sign you shouldn't ignore. Sign 6. Dry and itchy skin. Your skin is often a reflection of your internal health. High blood sugar reduces circulation, and the skin, especially on your legs, often becomes itchy, flaky, or dry. People try lotions and creams, but the root cause isn't the skin itself, it's blood sugar. Sign 5. Always hungry. Here's an interesting one. You can eat a full meal, feel stuffed, and yet an hour later feel hungry again. Why? Because your body isn't processing sugar correctly. Normally, a hormone called incretin slows digestion and tells your brain, I'm full. But with high blood sugar, this process gets disrupted. Your body mistakes sugar spikes and crashes for hunger signals. So if you're always craving food, even after meals, it could be a blood sugar problem, not a willpower problem. Sign 4. Excess abdominal fat. One of the most visible warning signs is belly fat. When your cells can't use glucose for energy, your body stores it as fat, especially around the abdomen. And unfortunately, belly fat itself makes insulin resistance worse, creating a vicious cycle. So if you're gaining weight mostly around your middle, pay close attention. Sign 3. Nerve problems. High blood sugar damages blood vessels that carry nutrients to your nerves. The result? Nerve pain, tingling, or weakness, often in the hands and feet. This is called diabetic neuropathy, and if ignored, it can become permanent. Tingling toes might not seem serious today, but it's an early warning of long-term damage. Sign 2. Skin changes. Dark, thick, velvety patches of skin, often on the neck, armpits, or hands, are called acanthosis nigricans. They're a visible sign of insulin resistance. If you notice these patches, don't just treat it as a skin issue. It's your body showing you something deeper is going on. Sign 1. Tingling and numbness. Finally, one of the clearest signs, tingling or numbness in the hands and feet. You know that pins and needles feeling when your foot falls asleep? Imagine that happening regularly, even without pressure on the nerve. That's neuropathy caused by long-term high sugar levels damaging your nerves. It's not just uncomfortable, it's a sign of ongoing nerve injury. 8 symptoms of diabetes. Now let's talk about the symptoms of diabetes itself. If several of these happen together, it's time to take action. Symptom 8, fatigue and hunger. You eat, but your cells can't use the glucose because insulin isn't doing its job. The result? You're left drained of energy and always hungry. Symptom 7, frequent urination. The average person urinates 4 to 7 times per day. But with diabetes, the body constantly tries to flush out sugar, so you go much more often. Symptom 6, weight loss. Losing weight without trying may sound like a blessing, but it's a danger sign. When sugar is lost in urine and can't enter cells, the body begins breaking down muscle and fat for energy. Symptom 5, dry mouth. Frequent urination pulls fluids from your body, leaving your mouth dry and uncomfortable. This also increases the risk of oral problems. Symptom 4, blurred vision. High blood sugar pulls fluid from tissues like the eyes. Left untreated, diabetes can permanently damage the retina and vision. Symptom 3, cuts that don't heal. Just like with high blood sugar, diabetes slows circulation and healing. Wounds may take weeks or months to close, leading to infections. Symptom 2, tingling in hands and feet. This is nerve damage, neuropathy, caused by prolonged high blood sugar. It may start with tingling or burning and can become permanent if ignored. Symptom 1, dark patches of skin. Darkened, velvety skin on the neck, armpits, or elbows often signals insulin resistance and diabetes. The bigger picture. According to the CDC, over 30 million Americans have diabetes. Shockingly, more than 7 million of them don't even know it. And on top of that, over 1/3 of the population, nearly 90 million people, have prediabetes. The scary part? Most early symptoms are so mild that people ignore them. But by the time more obvious problems appear, the damage has already begun. Nerve problems, kidney issues, even vision loss.